Ceann Comhairle. Minister, last week at Cancer Trials Ireland event, patient advocate Patrick Kivlahan spoke out about how participating in a clinical trial probably saved his life. He highlighted that delays in opening clinical trials to Irish patients could be a matter of life or death. I want to acknowledge that access to clinical trials is a government priority. The current National Cancer Strategy aims for 6% of cancer patients to participate in clinical trials. Sadly, we're far short of this target, with only 1.5% of patients on interventional trials, a decrease from 2019. One of the most significant barriers to patient access to these potentially life-saving trials is not money or staff, but red tape in the form of GDPR, the General Data Protection Regulation. The root cause of the problem lies in the application of GDPR in Ireland. Instead of protecting the public interest, it is costing patient lives. As Senior Counsel Paul Legan pointed out, our health system should be more concerned with making people well than in conforming to a uniquely Irish over-interpretation of the GDPR. The Irish Cancer Society recently highlighted this issue, pointing out that Denmark has 3 times as many clinical trials open to patients as Ireland. Industry figures showed that of the 3,500 industry-sponsored clinical trials started in the first 6 months of 2024 across Europe, only 11 included Ireland. Less than 1% of industry trials opened in Europe this year, despite Ireland being a global hub for pharmaceutical development and manufacture. To address this problem, we need to revise Ireland's data protection regulations on health research, as outlined by Cancer Trials Ireland in their recent position paper on GDPR. We also need uniform national guidelines for all hospitals regarding the interpretation of data protection in clinical trials, removing any set-up delays or document duplications. Minister, will the government commit to promptly delivering on such reforms? Finally, while the Shared Ireland Fund set up by the Taoiseach has supported key cancer research projects, it should be enhanced to fund actual clinical trial activity, allowing patients to access trials in cancer units immediately. Cancer Trials Ireland, in partnership with key stakeholders, has developed a proposal to run an all-island genomics trial with cross-border referral pathways, aiming to implement precision cancer treatment on this island, saving lives and reducing health service costs. Will the government commit to such an initiative?
Thank you, Deputy Naughten. Minister.
Well, thank you, Deputy Naughten, for your questions and the points that you've raised in this very important issue. And I know that you've been strong and continue to be a strong advocate for the expansion of clinical trials and expansion of access to them. The Minister for Health has been very clear that he wants to double the number of clinical trials taking place in Ireland, and I know you've made reference to that. Patients involved in clinical trials, as you have said, can receive cutting-edge therapies, often years before they're widely available, and some patients can experience much better outcomes if the experimental treatment proves positive and proves effective. They can be empowering for patients, and they do, of course, make a really vital contribution to medical knowledge and the development of new drugs and devices. In line with the programme for government, the Department of Health has made a commitment to expanding clinical trials here in Ireland. I think you've made a fair point in comparing Denmark and Ireland in relation to the scale, and we need to scale that up further and scale up our ambition. The commitment, though, that we've made and the Department of Health has made under the programme for government is embedded strategically across key policy initiatives, including the National Cancer Strategy, the National Strategy for Accelerating Genetics and Genomics, and Impact 2030, Ireland's Research and Innovation Strategy. The positive impact of research activity, including clinical trials, on the care of patients is universally accepted, and research supports the recruitment, the retention, motivation of clinical staff who will drive the development of quality services. I think, to be fair, significant progress has been achieved in recent years, but challenges do remain, and the government is determined to build on the progress to date, ensuring we have the best-in-class clinical trials landscape here in Ireland that delivers better patient outcomes. Over the last 15 years, actually, the Department of Health has invested more than 150 million in clinical trials and research supports. I actually read with interest as well, just on Monday of this week, and you would have heard Morning Ireland as well, with Dr. Austin Duffy, who's the Director of Clinical Trial Unit in the Mater Hospital. And I very much welcome that a new clinical trials unit has been opened at the Mater Hospital in Dublin, and that START unit hopes to have around 50 patients enrolled in the first year of phase 1 trials, and it will be a free service for suitable patients. That's the type of thing that we want to see rolled out across our expert hospitals. If you take particularly in the area of cancer, there's not one family in this country that has not been affected by cancer. And I think our oncology services in this country are excellent. The treatment is excellent, one of the best in Europe. But to ensure that clinical trials are being done and that we're continuing that research and trialling to bring forward new drugs and new treatments that are going to improve patient outcomes is a priority. I agree with you on this, Deputy. It does need to be scaled up. We need to scale up, not just the ambition is there, but the delivery in that space. Because when you compare us to some other countries as well, we have ground to make up. But I'm delighted, just using that example of the Mater, to see that clinical trial in place, which will be significant in itself.
Deputy Naughten.
Minister, in what is my last ever intervention during Leaders' Questions, I want to go back to this issue of genomics and cancer. Today, there are 2,435 people on the waiting list at St James's Hospital for hereditary cancer tests, including breast cancer. Some of these patients are mothers of young families waiting over 18 months to access a potentially life-saving test. Cancer genetic counselling is essential to access these tests. However, there are only 6 counsellors at St James's, and we fall short of the 20 needed to meet the international standards per capita. The demand, Minister, for these services is increasing. We must act now to develop a comprehensive genomic strategy, establish a single national laboratory, and ensure timely access to diagnostic services. These steps can save many, many lives, Minister.
Thank you, Deputy Naughten.
Deputy, I agree with you. And could I, as you've mentioned, it being your last contribution to Leaders' Questions, commend you on your years of service here in this House since 1997 and winning that by-election. I've always found you to be, whether you were in government or indeed in opposition as you are now, to be an excellent colleague, someone who's very constructive and who has the well-being of your constituents and indeed your constituents first and foremost at heart, but also in relation to the matters that you have driven yourself, no less so than this. And I know you'll know from us as colleagues as well here that we're all thinking of you over the last week or so, and that you're and just to wish you all the very best and your family in the coming period, Denis. Could I just say, Count Corla, I think Deputy Naughten has put forward very clearly how we can actually scale up the implementation of that ambition. We have some of the very best people, very best clinicians, very best researchers. Ireland is, in many areas, at the cutting edge of research. The clinical trial piece really helps to extend that further. And we do have, in July of this year, Minister Donnelly has established a National Clinical Trials Oversight Group, which is developing recommendations on increasing the number of trials taking place in Ireland and improving access to patients to participate in clinical trials. Now, those recommendations will be important, and just to give you, I am told by the Minister and by the Department of Health that the interim recommendations are imminent. And I think all of us can agree how important an area this is, and it will be for all of us to ensure that the interim recommendations are implemented and moved on as expeditiously as possible.
Just before calling Deputy Carol Nolan, can I join Deputy Naughten with the Minister in acknowledging the enormous contribution that you have made during your long years of service here, and extend, I know, the respect of all of the members and the sympathy of all the members to you and to your family in your recent tragic bereavement. We hope the next phase of your life is going to be as successful as the one you're bringing to an end when this election is called.
Yeah.
Can we now